of West Virginia. You are warm, wonderful. You know, you have a flood. I had a number of floods when I was governor. I'd open up the armories, the National Guard, make them available. It wasn't any need. People just took each other to each other's homes because that's the way people are. Well, that's sort of meant to be the relationship between the United States of America and its public policy towards health care and the American people. That you help people. That you're not there to push people out of health care. You're there to help people get health care when they need it and so that they can afford it. Which means you have to have, well, you can have all different ways of doing that. Some people say, well, let the private insurance market do that. Well, we've had a series of hearings in which we've shown the private insurance market virtually across the country. Did any of you see that? What was that wonderful movie with The Insider with Russell Crowe? It was about smoking or something. Anyway, we had his counterpart, the guy who worked for Cigna, which is a huge insurance company, for 20 years, and had the guts to come before us and testify yesterday on how it is that insurance companies plan deliberately to push people out, purge people out, the word they use, and make sure that the doctor doesn't get paid too much, that the patient has to pay more than the patient ought to pay, or what in fact they said the patient would pay, and put all the concentration on their bottom line. And that's, as far as I'm concerned, what it is with that. So don't expect me to have a lot of patience with insurance companies who say they're going to do something. I mean, it's like, you know, it's like when you get a prescription and then they have those pieces of paper and even, you know, I mean, glasses and all the rest of it. I mean, you can't read that stuff. You don't want to read that stuff. You can physically, and then you can't understand it if you can physically, or even if you're eager to read it. It's impossible. So they load it up with medical words and bureaucratic phrases which keep people in the dark. Now that's not the pharmacist. I'm just making that's what the insurers do. So I have come out very, very strongly, and oddly enough, as far as I know, I think I'm the only senator who put a bill in, pure and simple, on something called a public plan. I do that with a great deal of ease. A lot of people are terrified of it because they say, well, it's a government takeover. You know, like Medicare, for example. Yeah. You know how much people hate Medicare? Medicaid for people who need it. Going to school, things like that. I mean, the whole thing isn't just a private economy. If we could do health care through the private economy, that might be something, but you'd have to be certain. You'd have to be real certain about that. And the question is that people can change their forms and change their rules. But if you pass a law where you have a public plan which says that 45 million uninsured Americans and 25 million more underinsured Americans, and many, many more who are insured for periods of 6 months or 8 months and then don't lose it, or they're in or out of the pension plan. Everybody's under terror. Seems to be what you do is you put people at comfort and say, yes, this is going to be very expensive. Yes, everybody's going to hurt a little bit as a result of doing this. But you can either postpone it because you don't want to hurt anybody's feelings, or have anybody who sells, you know, medical equipment or any kind of physicians or whatever, or even patients. You know, patients may have to pay a bit more. But I think that the overwhelming percent of the American people want a health plan that they can count on, that works for them. another aspect of this, and we've also put a bill in on that. And it has the bill's called MedPAC, which is an immediate way to stop the conversation. But it's that group which decides, which Congress gave the power to decide how much do you reimburse. Let's say, like Wheeling and Pittsburgh are both in something called the same metropolitan statistical areas. Healthcare is so arcane. I mean, I didn't even take science in high school, okay? So, I mean, the literature is huge. But it's people's lives. It's people's lives. And so, I don't want to have 535 congressmen, only one of whom, as far as I know, is a doctor, who's in the Senate, deciding how much that a urologist or a back surgeon or a OBGYN is going to get reimbursed for a process, and then partly that based upon where that person practices. Do they practice in a Charleston or a Martinsburg, or do they practice in an Emmons or in a little rural health community over in Lincoln County, which has a terrific health community. But those aren't wealthy folks, and those aren't wealthy doctors. Now people say we're having a hard time keeping doctors. Well, I'm here to tell you that our medical schools are crammed with doctors. They're crammed with doctors. And yeah, they want to make enough money to keep their, but you know, one of the things that I sort of like, many things I like about Obama, is I think he's taken the fact of how much money do you make or how much are you worth. He's taken that off the table as a value for measuring somebody's real worth. As a result, that's why hundreds of thousands of young people and not so young people came out and worked for him. A phenomenon nobody had ever seen before. And the reporters were just falling all over themselves, figuring out how could this happen. Well, one was because Barack Obama, and you know, he didn't do very well in West Virginia. I endorsed him. In my heart and in my soul, which is either here or here, I don't know where it is, but it's real important to me. I knew that this was the man I had been waiting for all my life to be President of the United States. And so lots of people call me up and write me and how good you've done that. And actually what I did is I talked to most of them, called them back, and then we talk about it. And it just turned out, you know, that Clinton's had a heck of an operation there, and they spent years and years there. And she's very good. She would have been very, very good president too. And so it was much easier for people to go that way than to go, as I learned when I came in for the first time as a stranger, than to go with somebody who was new to them. And new to them in many ways.